Hi, everybody. We are live on this Thursday once again, right here on Facebook Live with coronavirus inside the Arizona numbers. On a little bit later today, Garrett, we had the county briefing us just before this, and we're also expecting the governor coming up at about 3 p.m. So we're about 45 minutes away from that anticipated update. I'm Katie Rammel, alongside me here, Garrett Archer. I always point the wrong direction. That direction is Garrett Archer. He is our data guru, helping us maneuver through the numbers and sort of make sense of all this for you. In the live comments, feel free to drop us a question. We can help you find data all throughout Arizona. We don't want to make decisions for you and your life and your family and your safety. We want to help you find the data, teach you where to find it each day, teach you where to dive into the numbers so that you can make the best choices for your life. And we always like to start, Garrett, on that summary page that comes down in the morning that you break out so well. There were a couple record numbers inside some of the items today. We'll get to that. But in the meantime, on the summary page, first and foremost, 58 deaths reported here in Arizona in the last update coming this morning.
Yes, as you can see right here, 134,000 cases with about 775, 1% of them being probable. Today, 2,492 in total deaths reported. The cases reported today, 3,259. And as you said, 58 deaths, which is not a high for Arizona, but it's certainly sort of pushing our mean average death numbers up now, because we're starting to see typical reports, daily reports with higher numbers.
And we still had, I think, about 13,000 tests come in yesterday. Is that around the number I saw?
Yes, 13,000 tests. Today we had a percent positive. It's percent positive of the ratio for the diagnostic test was about 24%, a little higher than it had been for the last couple of days, but still nowhere near where we were the last about a week or two ago.
Yeah. What other numbers on this page before we dive right into the questions? So many of you joining us on here, and we want to thank you for that. We'll get to those questions as well. Kim, I see a great question from you. We'll get to that in 1 second. But Garrett, anything else on this page that we should highlight first off?
The only other thing to highlight would be the PCR percent positive. This number was 14.2 yesterday. It's gone up a tick to 14.3. We don't want to see this number go up, but really, several weeks ago it was going up by 2-3 tenths of a point every single day. So right now, it's sort of we can take what we can get, and if it's a tenth of a point, then that's what we can get. So, and
I always remind people this number, that particular number right there, that percentage is over the entire span of this
yes.
Of this virus. So it's not necessarily a snapshot into this specific time, but over the whole life of the virus. And we can get into this specific snapshot a little bit more in a second, but these questions are rolling in and I want to dive right into them. Kim Booth is asking us to help her find what are the ages of those who have died within these numbers. And Kim, we can find that for you so easily. Garrett's on the Arizona Department of Health website. So this is a site that anybody can access, and it's updated every morning. And Garrett, what are you seeing for the ages, if you can read them off, because I know they're so small on everybody's cell phone?
In the age categories provided to us by the Department of Health, we have 9 deaths for those 20 years and younger. In the 20 to 44 year range, 148 deaths. In the 45 to 54, 168 deaths. 55 to 64, we're at 350 deaths. And then 65 plus, we're at 1,817 deaths.
So Kim, this is a spot that you can access on that page, and it's updated daily, so you can get the very latest numbers on there. I'm having so many questions. First of all, I want to welcome everybody that's joining us on here. We every day dive into the Arizona numbers. So I've noticed some of you watching now from across the country or really anywhere in the world, and we thank you so much for taking interest in what it's looking like here in Arizona. If you're asking for other places, we dive into the Arizona numbers. So that's what we can help you find right here. We can somewhat put it in perspective, a national and global perspective as well. But these numbers are specifically the Arizona numbers that are coming in. We should talk about ventilators, Garrett, because are we at a record high number of use? Now, the caveat in all this, we do have enough ventilators here in Arizona at this point, but it's something worth noting if we're passing a high number in that.
Yes, and we can look at that at the this chart right here in ventilator usage and availability. This shows the entire census of ventilators since March 26th, and today we did hit a high of 53%. over 1,000. But as you say, we still have about 890 ventilators yet left. So we don't seem to be in any sort of issue with ventilators right now or running out, anything like that.
Paul is asking the true numbers of ICU for just COVID in Arizona. We can break down those numbers for Paul based on people or patients who are sick with COVID and those who are in the ICU for a number of other reasons outside of this. And that's on that hospital specific metric page. Also, Paul, on the Arizona Department of Health site, and Garrett will highlight those numbers for you so you can get a better look.
So as you can see right here, it's hard to read these numbers. I totally understand. We reached a high so about 3 days ago, we reached a high of 970 in the ICU. Today it's gone to 929. And then, yesterday it was 929, and today's report showed us at 918. Something to know about this number, of course, is that this is a combination. The lowering in this number is going to be a combination of both people who are being transferred out of ICU, step down sort of recovery, and also people who die from COVID-19. So just something to understand what this number is.
Yeah, so not always a number to celebrate. You can't necessarily say that those people have gone on to recover. So it's an important place to look. Let's see, I just had a comment that rolled by that I want to get back to just a second ago. Thank you all for joining us on here. You're commenting so fast that it's speeding by. Oh, Monica is asking, not all ventilators are COVID-19 positives, right? That's absolutely right. Ventilators obviously can be used for any number of patients, but we're able to break that out based on who are the COVID patients versus who are not.
Yeah, there's about 657 of the 1,000 ventilators. So about 65% of the ventilators that are being used right now are being used for COVID-19 patients. As you can see, that number is also, as far as COVID-19 specific metrics, has gone down from a high on the 13th as well. And obviously, because of the correlation between ventilator use and an ICU bed, I expect and do see these numbers correlate very, often, with the ICU and the ventilator numbers for the COVID patients.
Yeah. Holly Solomon's asking, have the numbers gone down? I'm not sure, Holly, which number in particular. Let's just assume you're talking about cases, and if I see another comment from you pop up, let me know what we can help you find. But overall cases, there's a second question. Are people getting better? So two separate questions there from Holly. First of all, are the numbers going down? Garrett, at last check, it still looks like we're in a bit of a plateau if we're assuming Holly's asking us about case numbers.
Yeah, we are in a plateau. We have, as of recently, we have now what is a divergence between the reported case numbers and the reported test numbers. So we now have a situation in which our daily reports, we're getting more tests in and less cases. Do the cases go up? Of course they do, because it's a cumulative number. So we will always see an increase in case. That's why we pay so much attention to the percent positive, because as we can see the more tests, the less cases, we'll start seeing that number start to go down and that reported number to go down. And that's something we're looking, we're looking very strongly at that number to make sure that, because that's going to be one of the biggest ratios to follow.
Yeah, I kept pointing that out early on as we were seeing these numbers start to grow after the end of May, that a rate might be a better number to look at as we were ramping up testing than just hard case numbers in this. Another question that we get so often is about deduplicating the positive cases, and those are deduplicated, something that we got an update on. So if you're going in and you're getting 3 different positive tests, that's the reason you're showing your ID when you go in, so that they can deduplicate those and only count you as one person within that. Garrett, what were some of the other numbers you were tracking closely today? I do want to remind people it's about 2:22 now, and we're expecting the governor to speak at 3 o'clock. We don't know necessarily what he's going to talk about. There is a lot of conversation out there that he'll have something on the schools. So I know that's of interest to so many families out there. And I want to let you know, you can find the very latest schooling information, your district's information, on abc15.com/schools. There's a whole interactive map there. You highlight your school district or the school district that you have interest in. A lot of them are pushing back the dates. It's going to be reflected for you in as close to real time as we get the information there. So you can find the very latest info. I see you're up on the hospital metrics page.
Yes, and I do want to just address something, as I've seen a couple of them go through the comments. Now, I know that there's been some news stories regarding data not being reported to the CDC and being transferred to the Health and Human Services. None of the data that we are looking at will be impacted by any sort of decisions or any sort of transfer of data from the CDC to the White House or to the Health and Human Services. This is all data that flows directly from the hospital systems into the Department of Health. There is no middleman. There is nothing from the CDC here that we look at. So, as far as this data, this will not be impacted by any sort of changes in that respect. So that being said, we're going on to the hospital-specific metrics. We are seeing a leveling off of this number. It did go down slightly today from 3493 to 3454, a very encouraging decrease. We've already gone through ventilators. We've gone through ICU beds. Our discharge number was not a record high by any means, but it was pretty much in that grouping. And again, I have to put on this number because this is the number that we use as a proxy that, in fact, all of the COVID tracking, Johns Hopkins University, everybody uses this number as a proxy, but you must understand that the discharge number will also have people who were transferred to different parts of a hospital, people who have died from COVID-19. It's essentially the release of a bed. So whatever releases a bed gets reported as a discharge. So you just understand that when you look at these numbers, a good majority of these people were probably stepped down, into different facilities, and they are in the process of recovering, but it's just something we don't know. It's just something we don't know. So that number has gone up. Emergency department numbers still sort of staying. It's gone down a little bit, but we can see, the trend is developing. A curve sort of is developing on the downward trend on there. We're looking for that. And then intubations, which is people who are fitted for a ventilator, that number is down as well, but still sort of within this whole July pattern that we've seen so far.
I want to get to a couple of questions. So many good questions coming in. Thank you all for sharing a little bit of your day on here with us. We hope to walk you through all the numbers. Al is saying, thank you. You're making this all make sense. So Al, that's what we aim to do, is to help you find the numbers, to walk you through those numbers. You know your family and your life best, and you know how to make decisions for yourself. We just want to help you find that information. We're staring at these graphs and these numbers all day, and let us save you some time by showing you exactly where those numbers are. So Al, I see your comment there, and thank you. Debbie is asking, will the governor's press conference be on TV? Debbie, yes. We'll have it on ABC 15 at 3 p.m. We will also have it here on Facebook Live. So you'll be able to see the governor speak on both of those fronts. And also we'll have a complete wrap for you at 4, 5, 6, and 10 p.m. And then I always post all of his executive orders when they are emailed over to me from the governor's office. And I'll be sure to post those of you who like to read through all of that. It's always on my Facebook page, and my Facebook page is right there on the bottom of the screen, facebook.com/news from Katie. Andy is asking about staffing and staffing some of these hospitals, and if we're going to have enough respiratory therapists. And here's what we can tell you, Andy. We've been tracking this so closely because one of the things that was promised was St. Luke's and the number of beds. We were always counting beds, and we were pushing to ask, do we have the people to be there to take care of these COVID patients? They take a lot of hours and a lot of nurses and a lot of people there to help everybody through this. What we can tell you, finally, is that more help is on the way. We told you about, was it 2 weeks ago already now, Garrett, that Mike Pence was in town, the vice president was in town. We asked for 500 new workers here in Arizona. We were promised that would happen, but then the contract hit a roadblock. It was not getting signed, and we're happy to report that has finally been signed. Not only are we getting 500 out-of-state nurses, we will have a total of nearly 600 brought into Arizona to work at the hospitals as they work to expand capacity. And those hospitals can receive those nurses free of charge. They can have them for up to 6 weeks here in the Valley if they need those resources. So that's the very latest that we're getting on that information from outside help. Thankfully, these nurses willing to give up time from their own families and come here to Arizona to help people here. So We are so grateful for this. Do we report this type of information daily? Jeannie, on the daily. Garrett and I are here the week daily. I should call it. We're not here on the weekends. Garrett still updates his Twitter account. I usually retweet those numbers as well, so that you can still get the numbers you need. Of course, we're teaching you where to find this so that you can find it every day out there. But yes, we are right here with you Monday through Friday. We usually get to hang out with you for more than 30 to 45 minutes and kind of walk you through all these numbers and any changes that are coming in. Garrett, I heard you quickly typing away there. I do have some more questions to get to, but we'll pause those for just a second to see what you're looking at.
I saw a question come by about long-term care facilities and what the deaths at long-term care facilities look like. And while we do not have that number for statewide, AZDHS has chosen to not share case numbers and death numbers from long-term care facilities with anybody. So what we do have, though, is Maricopa County does share this information, and with Maricopa County being the largest county, we can sort of use this as a proxy for the rest of the state. And this is their epidemic curve chart. I've selected the deaths curve here, and what they show you right here that about 45% of all COVID-19 deaths that have occurred in the county, the 1,200, are from long-term care facilities. But take a look at this chart. You can see that when I've been tracking this number for quite some time, when we were here in May, that number was upwards to 72%. Now we've gone down to 45%. So you can see that while long-term care facility deaths reached sort of a peak here in early May, it seems that whatever has been done to contain the virus and the spread in long-term care facilities has at least been somewhat successful, because deaths have stayed relatively constant throughout this entire epidemic curve. And so we're down from 72% of deaths to 45%, and this number has continued to lower just daily. It's just not the same as what it used to be.
Yeah, there are several ways that you could sort of interpret that as we're getting more information in, but just it was wild to see there at the beginning how many people were in those long-term care facilities that were at risk and then also dying of this. It was tragic. Let's see. If a long-term resident dies in the hospital instead of at their home, are they considered a long-term care facility death or a hospital death per Maricopa County statistics? Do we have that breakout for Matt?
I don't know the answer 100% on that, but what I can say is the majority of these facilities that are being tracked for this particular number are CMS certified facilities. They're certified by Medicaid and Medicare. So they would, in that sense, they would be included in the long-term care numbers if they died at a hospital. But I can't say that for like private nursing homes. I just don't know the answer to that.
Right. Really good question there. Vic writes, what's the lag time? And so that producer Carrie can find his comment. It's VIK, Vic with a K. He's asking about the lag time in this reporting. So each of these sites, obviously we're getting updates, Vic, every single day, but the numbers can be a bit delayed on certain graphs that you see. And most of the graphs do have a legend there at the bottom that tells you if it's 7 days, 7 to 10 days. It's right in that range, Garrett, correct?
Yeah, so I'm going to stay on Maricopa County to explain this, because this is something that the AZDHS does not, it gives an estimate, but it doesn't actually show it visually, and Maricopa County does a good job showing it visually. So you can see this, I'm on the cases chart right now, and you can see there is a portion of these from basically July 4th on that are grayed out. And what Maricopa County is saying when this is grayed out is saying, look, these numbers are going to change, they could change pretty drastically. So when you look at this average, when you look at where the case growth is, do not pay attention to these last numbers, because it's going to give you a false sense of security, because these numbers will be so low. And you can see, I said July 4th for this one. The date does vary. For hospitalizations, you can see the first day of confidence here that they have is June 30th. That's the day, and then everything after June 30th, they're saying this could still change, so we're not going to put this in our average. And then, but because deaths there's such a lag on deaths just on how they occur, there is no grayed out line on deaths. So they have although they have the 7-day average pulled off a little bit, they do say, look, when these come in, we have a higher degree of confidence when these come in that these numbers are not going to change that much.
For the deaths, you're saying?
For the deaths, yes.
Yeah. pretty final number there, unfortunately. One of the questions that's coming in, let's see, Christy was just asking, why am I on day 11 and still no results? So if the numbers aren't filled in, I'm assuming Christy's in Maricopa County. So if it's grayed out up to that point, it hasn't been filled in for the past week, but she's at day 11. That doesn't mean that they can't go fill those numbers back in based on the collection date. It's just, here's where we have the most certainty to.
Yes, there will be numbers filled in. I mean, I have examples of that all over the place. I'll show you one here in a moment as I pull it up. But yes, there will always be examples of data being
the outline, something come in late or something happened.
Much farther backfilled. I mean, there are sometimes backfilled 3, 4, 5 weeks in terms of deaths as well, and hospitalizations especially. Those two tend to fill in farther back than, say, cases and tests.
Oh, but Christy, my gosh, how frustrating to be waiting 11 days to get results. That should not be happening, and that's one of the efforts to try to get this testing going and reading the tests faster so that people can get results faster. Because how can we get a handle on this if we're taking that long to let people know you're safe to go out again, or you need to continue with quarantine, all of those things. So Christy, I know that has to be so frustrating. The tests are Sheila, or I hope I'm saying your name right. Miss Porter, she's saying testing availability due to available reagents. That's one of the things that we've heard is they don't have the reagents to be testing this as fast, and that was kind of one of the products in the holdup of getting this done in time. So hopefully the tests will start coming in quicker. We should highlight there are so many places to go get tested now. In fact, I'm sure Governor Ducey will talk about this, but the testing blitz that is coming up, they would like to get a massive number of people tested once again and get them tested quickly. So we'll get you the information on that. And I can also tell you some of these testing sites are open again. And the one that we've been highlighting, if producer Carrie can put up the address for Emory Women's, that's where you can get signed up. It's a 24, there's the address right there, Emory William, Women's, easy for me to say, health.com/testing-blitz/. That site is a 24/7 site. So you do have to register. You can't just show up there. But as long as you register, they're going to have that slot for you. And hopefully you won't be waiting as long as some of the other sites we've seen where you don't have to register, but then you just need to show up with an ID. And then there have been some really long waits. So hopefully that'll help get people some answers a little bit faster. Karen's writing, do you think we've reached a plateau? Karen, we were just kind of talking about this. It does kind of seem like these numbers are leveling off a bit, Garrett.
Yes, but there are some concerns, and this is it shows up on the chart I'm about to show you. So this chart is the Arizona case epi curve. So this is the actual date of infection, and as you can see right here, the biggest concern that I have right now is that this used to be a 7-day lag, and it seems now that it's closer to a 15, 16, 17, 18-day lag, because this 7-day rolling average should not drop off a cliff like this. So my concern is that, these numbers right here, this week is closer to this week. And so we're missing thousands upon thousands of tests because of a backlog. I don't know if that's the case. I just want to make that clear. But this is one of my biggest concerns because, as you can see, the 7-day rolling average has been thrown into a disarray because of this week right here. And this is the same with testing. These two correlate very well. And you can see that, again, the 7-day rolling average has been thrown out into disarray. And we might be, all these numbers right here have not filled in to get even close to this one yet. So these are just some concerns that I have. We're getting some good news right now in the cases of the testing, but we could potentially have, like I said, thousands upon thousands of testing cases that we're still waiting on. So, and that percentage doesn't show up on the death. And you can see the death curve does not have that same dragging down of the 7-day average. So that makes me sort of cautious because that means that the death curve is a little more current as to what's going on. And we might be in a situation where we don't have the tests and the cases filled in quite yet.
Boy, Stephanie's asking, with the 14 refrigerator trucks coming by next week. So those of you who haven't heard, the county was just announcing about the refrigeration trucks that are showing up to store bodies here in Arizona. They've never ordered coolers they haven't done this in the last 10 years. This is the first time. Although this situation is for anybody, any person who's passed. Obviously, there's a big need right now with everything that's going on. But Stephanie's asking, is there a projected number of deaths that we're expecting over the next couple of weeks? So I think there's a couple ways we can help her find the answer. First of all, Stephanie, one of the things that we talked about is kind of like the cycle in this reporting is 27 days, in that somebody gets sick, they get a test, they get a report. If they're hospitalized, that has a lag. So each step in the illness, if you will, has a lag. You don't immediately get your test results and then pass away from COVID necessarily. So what we were watching was this increase in hospitalizations. Well, first of all, we should say, Garrett, you and I spotted a big increase in the number of cases at the end of May, which would signal to us we're going to see another big jump in hospitalizations, which we then saw. And then sadly, the percentage of that end up losing their lives to COVID. And so we're starting to see that now. We had 2 days this week that came in the 90s. Today's number was 58 lives lost to COVID-19 here in Arizona. So can we help Stephanie find some of those projections in there as well for how we're looking? If we're following some of these charts, Garrett, we're in the high numbers for death right now.
Yes, I'll bring up I'm going to bring up a new site today. This is going to be, I'm not sharing my screen, so that's not going to be used. This is basically, it's viz.covid19forecasthub.org. So what this is all of the ensemble with the ensemble forecast. So this is literally 20 different forecasts sort of averaged together to get the best guess. And I know I've been relying on the MIT forecast a lot, but I just want to show you this one too, because this is, like I said, this is the ensemble. It's everything. So you can see this one doesn't make as far out projections because it's an ensemble forecast, because at some point they diverge so wildly that it's no longer useful. So this one is going to make a forecast to sort of the middle of August, and it's saying that we'll have about 3,796 cumulative deaths in Arizona by that time. That's what it thinks right now. I believe we are at about 2,400, so it thinks we're going to have about another 1,300 by the middle of August.
This is kind of interesting. It sounds like some of the things that they do in weather. They take several different modeling forecasts for the weather and kind of average them all together to get maybe a better look at how things are projected to arrive. That's kind of the same thing here.
Yes, this is all the forecasts. The forecasts that are in that are not grayed out here are the ones that are being used to make this guess. So and that's why it's the COVID-19 forecast ensemble forecast. So this is a good site to see sort of those all of them put together. And then if you just want to see them by themselves, you can filter them out and see what some of these others do. You can play around with this, figure out which type of forecast is the one that you like the best. They all have different sort of methods on how they arrive at their conclusions. So you know, and they're all valid, and that's why the ensemble's probably the best way to go, because it just gives it says, okay, we're going to take basically the ask the audience, if you will, you know, from that old show, the Millionaire Show, where you know, that it's the sort of the group wisdom can sometimes be the best.
Yeah, absolutely. Fascinating look at that. We'll leave that address up there for people who want to copy that down for just a second. Anastasia's asking if I can remind people about masks. Yeah, a lot of places are requiring masks now. She writes, Kroger, Walmart, Sam's, Costco, Best Buy, all requiring masks. This is very true. Last night we reported to you that Kroger, which for those of us here in Arizona is the parent company of Fry's, they were the latest one to announce this move to require masks in all their stores. Now, a lot of people on my Facebook page were saying, old news, we knew that. Well, in Maricopa County, we have masks mandated. So that's a different situation than what people are seeing maybe across Arizona, where masks aren't required. Now in those stores, there'll be a requirement. That for fries, that starts next Wednesday. And Kroger's not alone, as Anastasia just mentioned there. Walmart, Sam's Club, let's see, Best Buy, Starbucks, Costco, several others. So the National Retail Federation was also now encouraging all retailers who are nationwide to sort of adopt their own nationwide mask policy. So we may see even a few more of those making that choice so that they can protect not only their patrons to the store, but the employees as well. I saw this question from Ellie, and Carrie just popped this up. We're thinking alike here, Carrie, because I wanted to get to this. Ellie's asking, where do you get your data now that hospitals aren't reporting to the CDC? This is very concerning to me. This is concerning to a lot of people, Garrett.
I understand. So just to understand, just to answer that question, that's farther up in the chain than what we're looking at. So, what we're looking at is hospital systems to AZDHS, and that's a different chain. That's for basically an aggregated hospitalizations and other statistics for COVID-19 for the entire country. Since we're looking at statewide data, it does not impact our data whatsoever because it's coming directly. That our link is from hospital systems to AZDHS. Has nothing to do with the CDC or the Health and Human Services or anything like that.
Yeah, so while that can be concerning separately on its own, what we're experiencing here, I keep telling people in the last 24 hours, it's like if we were playing the game of telephone and we all sat in a circle, we wedged ourselves in and got there right at that second seat. So we're getting it straight from the state, and that's why our numbers are being updated so quick, because we're getting it right from the source.
Yeah, and I can show you basically, just so everyone knows, I'm not just saying this to say this. If you go to the AZDHS dashboard and you look at, there are these little, on most of these, we'll go to the hospitalization and usage, there is a little information plot right here, and it's hard to see, but it says the data, it says EM Resource is an online platform, and then it comes out with some other stuff. EM Resource is a state platform that the hospital systems use to report data to the state. So that because we're getting this data directly from EM Resource, we don't have to worry about the CDC or anything like that. And then the COVID-19 specific data, or some of this stuff goes through what's called MedSys, which is another hospital system, a reporting system that the hospitals use to basically track patients all across the entire state. So when we say, this is why when we say cases are not deduplicated, we have some confidence that that is proper because they're using a patient tracking system to give us these numbers. And when you have a patient tracking system, even COVID or not, you don't want to have duplicate patients in your patient tracking system. So they're going to do their best to deduplicate them. And the processes were already there prior to COVID-19 to make sure that the system deduplicates.
David Kerr is asking about the Navajo Nation, and David writes, the Navajo Times reports the outbreak in the Navajo Nation is improving. David, they've had some really aggressive shutdowns that have lasted 57 or 58 hours over full weekends to try to be able to get this thing under control in that area. One of the hardest hit spots in Arizona early on. And how are those numbers looking now, Garrett? I know they were doing a really good job of keeping things, at least leveling things out. And then they were upping those restrictions on the weekends once again when it seems like they saw just a tiniest bit of a pop in numbers. How are things looking right now?
So Navajo Nation has been, like you said, the outbreak has certainly been improving. Today was a bit of a bad day for them, but this is on top of 20 days of really good days. So they had a 1% case growth today. They had 80 cases reported and 4 deaths, but this is the first time in almost 20 days that they have reported a case growth of over 1%, and they have not reported a case growth over 2% since, I'm not even going to give you a time because I don't have the thing. It's been since May 28th is the last time that they did 2%. So it's been over 2 months that they've done over 2%. They do report recoveries. So the Navajo Nation says that out of the 8,370 cases, 6,184 are recovered at this point. So more than half of the cases that they report in the cumulative are no longer active.
Mm-hmm. David, really good comment there. We always want to keep a spotlight on what's happening there as well. Teresa is asking, am I reading DHS page right? They now have a saliva test. So the saliva test, Teresa, is through ASU. They've had, I know of at least 2, Garrett, areas that they were able to have testing sites set up. One was last weekend, and then the latest I had heard about is Tuesday. Had you heard about any others since then?
I have not heard of any others.
I think those were the last two that we had heard. But yeah, that's who the saliva test is through, Teresa. One of our other viewers on here said you do have to be over 10 years of age, because I that caught my eye when I thought, wow, a less invasive test. And being able to check on my kids, they were not down for a nose swab at all. So that might be of interest. But one of our viewers said, yeah, that was 10 and over. So just so you know, we'll obviously keep you updated on the air when we hear of the next one. Christopher Thomas asked, I got here late. We're always happy to have you. You're never late, Christopher. Thanks for taking time to join us here. He's writing, have you gone over the RNOT number? We have not gone over the RNOT number just yet. We don't expect a huge swing in it from day to day, but it's definitely worth noting. And Garrett, I'm assuming you're going to pull up rt.live for folks.
Yes, I pulled up rt.live. And here we are in Arizona. Our RNOT right now is 0.98. It's still under 1. Now this is still great. It's gone up a tenth, but you know we're still under 1. But we also have to understand again that with the testing delay and the case delay, this could be this estimate could be off. I'm just trying to basically let everyone know of all the angles. While it seems like it's a good information and a good metric, we hope that is a good metric, but we have to also understand that looking behind our shoulders, there is this case and test delay that might change this RT and make it go up. So we have to be patient with this. And hopefully in the next coming week or so, AZDHS gets through the backlog and we'll get a better idea of what the R0 is. And they changed this estimate for the entire thing. So as you can see, they had it 90. We had it 97 yesterday, but they put us at 98 as well. So it's not like track day to day like the AZDHS, where it's like, oh, yesterday was 0.97, now today is 0.98. No, they redo the entire curve every time they recalculate.
So what was our range? Obviously, this chart is saying they're 95% confident that we're at that number, but that range is pretty wide. It could really bump us way into the red in the chart or even further down in the green.
Yeah, our range is 0.81, and then our upper range is 1.19, which would be up here at about Idaho, North Dakota, right here would be up here would be the height, our high range right now. But we are still in the green, so in the RT. So that's at least good information. I would expect the governor to show this today at his press conference.
Yeah, Stephen Daniels is asking, what's the plus or minus for the R0? I'm assuming that's that range.
Yes, that's the plus or minus, the error bars, if you will.
Yeah. Brant's writing, thank you. Brant, you're so welcome. We're just happy to jump on here and be able to help you guys find the info, help you learn about the newest websites that we're finding that are tracking everything out there so that you can make the best decisions for your life. I always say, we're not here to decide for you. We're here to help you find the numbers. We're happy to look up numbers for you, show you where we're finding these, teach you where to find these so you can do that fairly quickly. We are about 10 minutes out from 3 o'clock. We are expecting the governor to talk at that time. We want to let you know that our reporters and photographers are already placed there on site, ready to ask questions, ready to hear from the governor. Any new executive orders, I'll be sure to post on my Facebook page for you. And then we'll have a complete wrap, as we always do, at 4, 5, 6, and 10 p.m. so that you can get the very latest information on what's happening out there. We were really expecting something on the schools. I think that's why so many people are tuning in to find out if he's going to push back that date for schools, if he's going to put more money out there for those families who have kids who are in the special needs category, who really feel they're being left behind in all of this. And, some of the deadlines, Garrett, to apply for funding for those families ended on May 15th. We were still just wrapping up a stay-at-home order at that time. So really, if that deadline could be extended for those families, it would really change a lot of things for all of those people. Allie asks, is there data for kids 5 and under who have contracted it in Arizona? My son has asthma, so it's a concern for me. Oh, it's so scary. I have so many friends so many friends who have kids who have asthma and different things like that, and they're still worried about their kids. So let's get to that. The best numbers we have are for 20 and under. they're not broken out into subcategories, except for, I believe, the county has 18 and under. Is that right, Garrett, or are they all 20 and under?
No, some of the counties do 19, some of them do 18. In fact, the Yavapai does give us some indication on what their younger age demographic looks like, and I'll tell you what that is in a second. But this is what we have right now. We have 15,000 cases are less than 20 years old. That's about 11% of all cases in the state. Yavapai County, they have 1,283 confirmed cases right now, and their 0 to 12 age group is 42. So 42 of those 1,283 cases are or have been, because these are cumulative numbers from that 0 to 12 age group.
So Allie, that's the best place to search, and that's the best breakout that we have at this point. If those numbers start to expand, we'll be sure to highlight that here if they're separated into any other age groups, because it's a question we get so often. We also have 9 deaths in that category too, Garrett. Is that at last?
Yeah.
So sad. Cannot imagine going through something like that. Online school sucks, somebody writes. Yes, it is very hard when you're working from home and you're trying to be your kid's teacher and assist them on learning and the internet. You're all trying to use the internet, and some people don't have the internet or they don't have devices. It is a massive, major concern. It is the cause of many tears in my household and several others out there when you're trying to manage all the things and teach your kids and do your work. And I'll have some deep bags under my eyes during the newscasts at 10 p.m. when school starts once again. All right. Let's see. We have time for just a few more questions. Cynthia's asking about, of the 50,000, how many of those 15,000 are hospitalized? Cynthia, I think you're asking about the kids, the 15,000
Yes.
Under 20. Do we have hospitalization numbers for that group?
We do. It's 99. It's a very low number. The hospitalizations that were recorded, the 6,296 hospitalizations that have been recorded so far, 99 of them have been in that less than 20 years old age group.
Yeah. I'm going to ask producer Carrie if I think that we can keep going pretty close till 3 o'clock, and then we're going to hand this space on Facebook Live over to coverage of the governor as everybody gets in place over there. Garrett, any last questions that you saw that you want to get to, or any last stats as we have 4 minutes, and then we got to wrap it up. We got to hand it off to the governor, what everybody's waiting to hear at this point.
The only thing I could share, if anyone wants to see, I put together a timeline chart of the milestones essentially on my Twitter, and I'll just share that right now. This is basically this is the 7-day rolling average of reported cases with all of the different milestones that have happened in Arizona so far, from community spread being detected all the way back in early March to the stay-at-home order right here, and then you can see we go all the way up here to the peaks where the governor was made his additional order. There's the mask ordinance right there, bars and gyms and water parks being closed. So this sort of just gives you an idea of what has happened so far, for the entire timeline of a pandemic here.
And Garrett, the blue is cases?
Yes, that is reported cases on a 7-day average, to just smooth it out.
Wow. And if people want to get a better look at that, or they want to dive into it, Jessica's saying, yay, a new Garrett chart. We love a new Garrett chart too, Jessica. Thank you for saying so. Better than yesterday's chart, Garrett, as we've been
the pen scratch? Yes, better than the pen scratch.
Giving you a hard time about that one. Stephanie writes, thanks, guys. You guys are awesome. We think all of you are awesome, too. We honestly are so humbled. We just started jumping on here each day a couple of weeks ago and wanted to help you better understand the numbers, help you and your family make the best decisions. As I always say, we're not trying to make the decisions for you. We want to show you where to find the numbers so you can have fact-based decision-making in your household with your family. So, Sherry writes, I've been following you for a couple of weeks. Just realized who you all are. Oh, yes. We're here on ABC 15. It probably look a little different sitting on the floor in my son's room, and this is his bedroom that I've taken over to sort of have a home studio. And Garrett, you're in a home office there?
Yes, that I share with my 5-year-old.
Oh, I love it. Monica writes, Garrett's our nerd friend with all the charts.
This
I
is
love
true.
it.
This is
I
true.
love it. We are so lucky to have you on staff, Garrett, to help us make sense of all these numbers and really dive into all this stuff. So let's see, we're about 3 minutes away from the governor talking. I want to let you all know, everybody always asks for the latest information on schools. There's a full interactive map on abc15.com/schools. Producer Carrie putting the web address up there for you. This interactive map allows you to click on different districts, click on your own district, find out what's going to go on with your kids. Stephen's writing, I can barely make a pie chart. Thank you, Stephen. Yes, I know. I feel the same way. So back to schools, that's where you can find that information. There's a whole section on abc15.com/coronavirus. You'll find all of our reporting there, all the very latest details on coronavirus. And as always, we invite you to join us on our newscasts for a complete recap of the day. 4, 5, 6, and 10 p.m. Heather's writing, the best kind of friends. We agree. We agree. Garrett, that's you, having you as our friend. And Garrett sits next to me at work, so I'm extra lucky, except that we're all outside of the studio right now. There's just a few of us in there. Debbie, thank you. You have a great evening too. We're going to invite you all back tomorrow where we dive into the numbers even more. We hope that you are safe out there, and we'll see you in our newscast. And now we are minutes away from the governor speaking.